Hi, I'm Dr. Kate Barry from the Holistic Health and Nutrition Clinic. So clients often ask me, what is functional nutrition and how is it different from standard nutrition? So the simplest answer is that functional nutrition is a patient-centered approach rather than a disease-centered approach. So it focuses on the body as a whole ecosystem, and the main goal is always to find the root causes of your symptoms. Functional nutrition is never one size fits all. Instead, it is a highly customized holistic health perspective that takes an individual's unique specifications into account. Functional nutrition follows a systems approach that takes into consideration how interrelated every part of the body is. So we're looking at the big picture of health by restoring optimal physiological functioning. In contrast, standard nutrition broadly follows nutritional guidelines created for the entire population. So it's often more difficult to put standard nutrition advice into practice due to issues such as food sensitivities, not finding the root causes of your symptoms, and also the practitioner not fully knowing or understanding your unique history. So to really explain what functional nutrition is, I've come up with 5 foundational factors of functional nutrition. Bit of a mouthful. So the first one is root causes. So we are always looking for root causes. We're not simply trying to band-aid symptoms. Instead, we see them as clues to figure out what's actually going on. So Dr. Dale Bredesen coined the term 36 holes in the roof to describe chronic illness. So there are many factors contributing to your suffering, and we need to find all of them. We need to address all of them. There is no single pill or protocol that will fix your symptoms, or very, very rarely anyway. So basically, we need to find all of the holes in your particular roof, and we need to plug as many of them as possible. And the second foundational factor is that we are all unique. So functional nutritionists look through a lens of bio-individuality. Your physiology and dysfunctions are the way they are because of myriad factors that are unique to you. You do not fit into a predetermined formula. You are an individual with a particular history, a particular lifestyle, a particular body type, particular experiences, and you also have different goals and aspirations to other people. Functional nutritionists work with all of these factors to create a personalised plan just for you. The third factor is that everything is connected. Functional nutritionists take a systems-based approach, considering the interrelatedness of every part of the body and looking at the big picture of health by bringing balance and restoring proper physiological functioning. The fourth factor is that all things matter. So although we're talking about functional nutrition, it is not simply about changing your diet. Literally everything you do matters. So nutrition, hydration, stress management, sleep hygiene, gut health, movement, it all matters. So, functional nutritionists will identify the triggers that likely contributed to your current state of disease, and they start to reframe what has and hasn't worked in the past as clues to find out what is going on in there. So what is going on in your unique body. And the fifth factor is teamwork. So we call this a therapeutic partnership. Today's chronic health challenges are best served by practitioners and patients working closely together. And the client's input is just as important as the practitioners in this kind of therapeutic partnership. So this functional nutrition approach and clinical framework can be applied to every single client experiencing health issues. So functional nutritionists address the terrain in which the client's dysfunction developed, rather than trying to address the specific diagnosis or symptoms. So the best way to visualize this is the 3 roots, many branches analogy. So if you imagine a tree with the branches as any sign, symptom, or diagnosis, and then the roots are within the soil. Now these roots are responsible for the majority of chronic illness we see today. So these three roots are genes, digestion and inflammation. So when we address these downstream roots, what we see is positive effects on the many upstream branches that are being fed or actually starved by these downstream roots. Also, fortifying and nourishing the soil in which those roots exist is a must. So that's it from me. Thanks for listening. Leave a comment below if you want to learn more about functional nutrition and our specific process at the Holistic Health and Nutrition Clinic. Thanks.